Uh, Good afternoon, everyone, and welcome. Thank you for joining us for this pre-recorded webinar. I'm Dr. Sarah Long. I am a researcher in child health and wellbeing at the Decisive Research Centre. And I'm going to be talking to you today about some of my work looking at Wales-wide school reforms. Before I go into the detail of my research, I just want to quickly go over the wider project, a description of the wider project where this research sits. So I've been funded by Welsh Government to carry out a 3-year research fellowship, and the fellowship has 3 research components or studies that map onto the 3 years of the fellowship. So the one that I'm going to be talking about today is this first one. So this piece of work was about understanding the aims and processes of school reforms with a particular lens focusing on health and well-being. And basically I carried out interviews with senior stakeholders in the Welsh education system. There was representation from Estyn, Public Health Wales, Welsh Government Curriculum Development Team, Professional Learning Team, and many more. And I carried out a thematic analysis of the data, basically generating themes to describe what interviewees were talking about. So I'll say a little bit, I'll go into detail about that in a minute. But I'll briefly mention the second two components so that they're on your radar, because I'll probably be talking about these at a later date through the Shin webinars. So the second component is about developing a framework for an outcomes evaluation of the impacts of the reforms on pupil health and well-being. And this will essentially involve plotting trends prior to the school reforms to look at pupil health and well-being, with a view to doing a longer term evaluation. Over the coming years, there will be multiple evaluations, but basically we're looking at a kind of 5 to 10 year period when the reforms will have had a chance to take effect. And then the third and final component, which will be around the time of rollout of the reforms, is about understanding school staff perceptions of and preparations for the new curriculum. And that will involve case studies in schools across Wales. So, as I said, I carried out a thematic what I'm going to be talking about today involved carrying out a thematic analysis of interviews with senior stakeholders in the Welsh education system. And the analysis showed that these were the 3 thematic areas. So I did a webinar that was aired live last week and is available on the website. And during that webinar, I talked about the first 2 thematic areas. So the changing role of schools over time and the current landscape, and the future role of schools and reform aims. And today I'm going to go into detail about this 3rd thematic area. So kind of the complex space between vision and success. So at the time I did the interviews, the high level what was very clear, that vision about what is going to be expected of schools, but the how to achieve those outcomes had not been fully articulated. So this essentially is picking up on some of those kind of implementation factors that can help schools to realise the aims of the reforms. This is just a summary slide of themes within this area. So some of the things I'm going to be talking about in a minute include achieving a cultural shift, factors to do with the accountability framework, and particular areas for targeting with professional learning and development with regard to the health and well-being agenda. So going on to the first theme, there was this idea then that to realise the aims of the reform, there needs to be a large-scale cultural shift. We're talking about systemic change, and arguably this is kind of the biggest realisation or implementation challenge, because you are trying to convince a workforce of 20 to 30,000 people to buy into the reforms, and schools and practitioners are currently at different places in this journey. And it came through loud and clear that practitioners need to be given the time and space to get to grips with the changes, and to make mistakes, and for trial and error. And, you know, this is a challenge in itself, because we know that schools are busy and fast-paced environments. So as things currently stand, as I said, there's variability in the system. So some teachers might not yet see themselves as health and wellbeing teachers, or those involved in the health and wellbeing agenda. And, you know, ultimately successful realization and successful implementation comes down to what happens in the classroom. So that is hugely important. And I've just got 2 quotes here to demonstrate, I guess, the importance of achieving a cultural shift. I'll give you a minute to read these. So these quotes demonstrate that this really is a big, big challenge. And the first quote kind of highlights that, highlights what's already happening. So, you know, there's a lot to be gained from putting the right resources in place, and for schools accessing those resources to achieve change. I'm now going to turn your attention to some suggestions on how to achieve this cultural shift. So the first thing I'm going to talk about is the accountability framework. I'm stating the obvious here, but the accountability framework, as you know, includes the metrics by which schools are judged and dictates the direction of the school system and how schools operate. And I'm just, before I say a little bit more about this, I'm just going to leave you with a quote for a little bit of time on one participant's view on the accountability framework. Okay, so that one really packs a punch. So as I've said, the accountability framework dictates the direction of the school system. And it was suggested that the accountability framework as it currently stands, so this kind of narrow focus on performance data, has become the point rather than telling us something about the point, which is arguably to improve societal outcomes and economic success. So, you know, I've got a specific example of, you know, in some cases where schools focus on the proportion of children getting 5 A stars to C, and essentially concentrate resources on borderline CD children in an attempt to push them above the threshold. And this may be at the expense of kind of high or low performing learners. Obviously, this is a problem that's very relevant for secondary schools, but actually, and I've described this elsewhere, there was talk of tracking systems from ages 4 to 15 to predict grades, and talk of how the accuracy of this tracking system was perceived as more important than learner outcomes. And, you know, I think there's recognition within the system now that it's important for learners to leave school with a range of skills to fulfill their potential. So, you know, whether that's in vocational courses or through apprenticeships. And, you know, with the current situation, you know, it could be argued that some subjects such as maths and science are valued more than others, such as arts and music. And obviously this is problematic because you need artists and musicians for a flourishing society. So we're at a point where we kind of need reflection of health and well-being in the accountability measures, and it's not at the moment. And this can be problematic during, for example, assessment periods where it can get dropped by the wayside while schools and practitioners focus on, you know, your kind of core subjects. And contrary to this, a school could be doing amazing health and well-being work, but it's not reflected and it doesn't win points essentially. So, you know, one participant gave an account of how there are some really great schools doing great work who have decided not to focus on the gaming, with the accountability gaming it was referred to as. You know, for example, your focus on CD children. But this person described how if something goes wrong, for example, if your data is skewed by a few families, then it could cost jobs. And, you know, suggested that going forward, a more rounded accountability framework is needed, and whether or not health and well-being is equally valued and how it's included going forward is going to be very, very important. I'll just give you a few moments to read these two quotes. Okay, and then I'm just going to leave you with another quote which highlights this kind of, you know, learners are leaving school and entering the workforce, and employers are describing a deficit in skill sets at the moment, and how this is kind of related to the accountability framework as it currently is. Okay, so the importance of professional learning, and I'm referring here to both continuous professional development and initial teacher training, can't be understated. So, you know, some participants, and this isn't a view that was shared by all, but some participants described this as the most important, most crucial part of the reform, and as a means for achieving that practitioner buy-in and achieving that cultural shift. One participant described how at the moment there is a national issue with the quality of teaching in Wales. So as I said, this isn't a view that's shared by that was shared by all interviewees, but it was described in you know, it was alluded to in more than one interview. One thing that was interesting was it was described how there are currently a lack of support structures in place in the education system, and potentially a lack of opportunities for continuing professional development. So one senior stakeholder described how they were involved in some of the early stakeholder groups, talking about the professional learning agenda. And this person was from health, and the person reflected on how it was very familiar in health, because health professionals such as doctors and nurses and so on have got clear systems, kind of there's a clear acknowledgement that they need ongoing continuing professional development and supervision and support to enable them to do their role and be effective practitioners. And also their health and well-being is hugely important and impacts on their ability to work effectively. And the person reflected on how it was very, very interesting for her how it wasn't embedded, and finally described how it's not just about equipping teachers with the skills that they need, but it's about creating a professional environment where practitioners are supported in carrying out their duties. And there's this idea that besides this kind of obvious professional learning for practitioners as they're moving from deliverers of the curriculum to designers of the curriculum, obviously the health and well-being agenda needs to be accompanied by appropriate professional learning too. And a risk of not doing that is that there may be poor delivery of the health and well-being agenda. And there could also be avoidance of topics or outsourcing, which has been associated with insufficient coverage and pupils missing out on key learning because there is, a training day, for example, and pupils are not in on that day. And it also doesn't give practitioners and learners the opportunity to build up these kind of trusting relationships in the school environment. And some of the areas that are suggested for coverage within professional learning include child and adolescent development, the whole school approach, which I'll say more about in a minute, the use of data and evidence, and I'll say more about that too, and also inequalities. So thinking about this idea then that there is PGCE in health and well-being, there was kind of mixed views on this, I suppose. You know, it was suggested that this would be beneficial, but one of the problems that was associated with this idea was that there's a risk that the health and well-being agenda falls to one or a few people. And that's problematic because we know, for example, thinking about things such as the whole school approach, that actually this is something that needs to be adopted across the school, across the workforce. And, you know, adequate training across all teacher training programs can prevent this from happening and enable a whole school approach to be adopted. And, you know, there was the idea that you might have different levels of professional learning depending on the practitioner's starting point. And just going back to this point on the idea of more space and time, you know, it was acknowledged that more than the odd inset day is needed to get this right. Okay, so thinking about a data and evidence-led approach then, and how schools can use this to realise the aims of the health and wellbeing agenda. So the use of data and evidence can be used to inform school level priorities. And this is related to something I talked about in the previous webinar, you know, about schools and practitioners being given more autonomy and freedom to design the curriculum in their local contexts. You know, and essentially adopting this approach avoids the risk that initiatives are delivered which are ineffective or irrelevant for that context. So data can be used in two ways. If we take the School Health Research Network data, for example, these data can be used to identify health and wellbeing thematic areas, as I've just mentioned, such as sleep, alcohol, bullying and relationships, and can also be used, for example, in maths lessons, where you would be equipping learners with skills for numeracy, but also delving into health and wellbeing topics as well. And, you know, essentially, I've described before that schools are busy and high pressure environments, and adopting this approach means schools are able to focus their resources where they are needed most, which is more time and cost effective. And this kind of idea of a knowledge, skills and experience-based curriculum is kind of important here, because whilst the use of data can help inform those high-level priorities, it doesn't tell schools how to kind of change these, address these health issues, I suppose. So I'm going to say more about work with external partners later on, but I just want to pick up here that, you know, this kind of reinforces the idea that work with external organisations is really important. So, for example, Public Health Wales and other agencies, because this can help identify these kind of appropriate evidence-based interventions, and also potentially provide enrichment experiences for learners as well. So one participant described how, as part of this sort of, in one of the pioneer schools, as part of an kind of experience, learners visited the Heath Hospital and went to the bowel cancer screening department and worked with those for a day, and that really provided learners, it enriched the development of their knowledge and their skills. And then the final point is that schools can use pupil level data, for example, from the School Health Research Network, to monitor changes over time. I'm just going to give you a minute to read these quotes. Okay, so the use of data can be used to decide on what thematic areas to address. And this idea of adopting a whole school approach can help schools with the how to achieve change. So it's about getting the how right. So, it was acknowledged throughout the interviews that I carried out with senior stakeholders that in addition to curriculum content, you also need environmental change and engagement with stakeholders and external partners, such as parents and the wider community. So one participant described how you can't address inequalities, for example, through the curriculum, but you can begin to address some of those wider issues through the whole school approach. So an example comes to mind of, consumption of a healthy diet, so fruits and vegetables. You can't fully address, the variability in learners' diets by delivering a lesson. But for example, by providing healthy foods in the canteen, you can begin to sort of reduce the impact of that variability. So thinking about environmental changes, I've just included a few ideas here that participants described during the interviews. This is about integrating those environmental initiatives into the physical fabric of the school. So that could include things such as providing playground markings, as I've mentioned, healthy foods, opportunities for socialization, use of restorative justice approaches or other policy measures, and active travel. All of these things can be encouraged and relate to the kind of environment and the fabric of the school. So I think in terms of the curriculum itself, schools that weave health and well-being throughout the curriculum rather than having standalone lessons may do better, and time will tell with that really, and that's what evaluation is all about. But the participants I interviewed suggested that this would likely be the case. I just want to mention here the whole school approach to mental health and well-being. So I described this in a bit more detail in the previous webinar, but there was emphasis throughout the interviews on adopting a whole school approach to mental health and well-being. Just give you a second to read that quote. Okay, so there's just two more slides left, so there's about 5 minutes remaining. But I think this quote, this one here, is very powerful because it kind of illustrates how when things go right, they can have a huge impact on an individual's life. And essentially this quote highlights that this is the important stuff, this is the good stuff, and you can't write that into lessons, into a curriculum. So school leadership was described as very, very important, and it was kind of acknowledged that, school leadership teams know that health and well-being is important. They value learner health and well-being, but arguably this kind of leadership has been disabled by the current accountability framework and this narrow focus on attainment metrics. Again, going back to this point about time and space and how important that is and how leaders need to create that for the practitioners to really be able to get to grips with this. And again, I just want to pick up on the point about practitioner choices. So, it's really important that we get that whole workforce buy-in. And it was kind of recognised that in some parts of the system, the wider system, we're panicking when we don't need to be with regards to school leadership, because actually these kind of some of the shortcomings, I suppose, of in the system are as much to do with the system, for example, the accountability framework, as they are to do with the workforce. So that's really, really important. Okay, so the final slide is about external support, co-construction and stakeholder engagement. So, you know, it's kind of this idea that co-construction was weaved throughout the process of the designing the curriculum. And now this has to continue throughout the implementation phase as well. And, you know, I think it's widely recognised in the system that this peer-to-peer support, you know, learning between schools, whether they are pioneer schools or just schools that are doing well in a particular area, you know, this is going to be really, really important. And there's this idea that you know, when working with wider partners, this is going to be very, hopefully very an effective way essentially for schools to be able to plug a gap and achieve those wider targets when, you know, with a finite amount of resource and these kind of busy schedules. So, you know, it's about practitioners recognizing when they perhaps don't have the expertise to touch on some potentially quite sensitive topics. And that's where it's going to be, you know, this working with external organisations is going to, and these partnerships are going to be really important. So, you know, some of the organisations that were mentioned in the interviews were Public Health Wales, school nurses, mental health organisations, media, businesses, third sector, and there really is quite an extensive list. And obviously there's some really great partnership work going on already, but there's a high level of variability in this, and it's critical that all schools get this right to achieve success in health and well-being. I think it's also important to point out that whilst external, you know, working with external partners is really, really important, it's also critical for schools not to have an over-reliance on external support to deliver the health and well-being, initiatives. This, you know, outsourcing isn't the intention, it's about integration. So integration and delivery of health and well-being with work with external partners and organisations as complementary. So at the moment, partnership working can conflict with accountability gaming. So obviously, partnership working doesn't win favour under the current system. So there's little incentive, but like I said, there's some really, really great work of partnership work going on already. It's just that level of variability that exists at the moment. And the idea that a cultural shift isn't just required within the system, but actually, you know, outside the system as well. So it's with the public, you know, some parents, for example, and stakeholder engagement is a way of kind of getting around, for example, contentious views on particular issues such as SRE. And it was described how, and there's evidence to support this, it's important to engage with learners and with the wider community so that they feel like they have a stake in the school. Okay, and I'm just going to wrap up here, but essentially this slide is about clarification of resources, so funding, time and supporting documents. So, you know, I'm not sure if it already exists, but it didn't at the time that I did my review, but some people described how a list of available toolkits and resources in one place would be really helpful. And I have kind of created a list of key documents in my analysis. So if anybody's interested in that, please do feel free to get in touch. And then is this idea that while it's important to provide support, actually it's about backing off to a certain extent so that it's not a prescriptive curriculum through the back door. And I also think it's really important to be aware of other policy initiatives that are going on. For example, if you consider things like free school breakfasts and the potential extension of the school day, all of these things can have an impact on health and wellbeing outcomes. So yeah, I just think it's really important to bear those things in mind as well. So I'm going to wrap up there. Thank you for your time and attention. I hope it's been of some relevance, and I'm happy to take questions, and feel free to get in touch if there's anything that you would like to talk about. Thank you.